Hello, my name is Chelsea Hasty, and I'm doing my presentation on mindfulness meditation for cancer patients. Cancer remains the second most common cause of death in the U.S., accounting for nearly 1 of every 4 deaths. The American Cancer Society says that in 2014, there will be an estimated 1,665,540 new cancer cases diagnosed, and 585,720 cancer deaths in the U.S. According to the estimates from the International Agency for Research on Cancer, by 2030, the global burden is expected to grow 21.4 million new cancer cases, and 13.2 million cancer deaths. The experience of cancer can be so emotionally distressing for some patients that they may meet diagnostic criteria for mental illnesses such as anxiety, depression, or even post-traumatic stress disorder. With that being said, cancer patients need something to help improve their quality of life. I think that mindfulness meditation can be that. For those unfamiliar, mindfulness meditation is the intentional, accepting, and non-judgmental focus of one's attention on the emotions, thoughts, and sensations occurring in the present moment. Mindfulness meditation can help improve the quality of life and create a more positive attitude. Some may ask, what is quality of life? It is the standard of health, comfort, and happiness experienced by an individual or group. Everyone wants it, just as everyone wants happiness and to be free from suffering. Though research says meditation may not prolong the life of cancer patients, I believe that it helps with the mental things like stress, mood, depression, worry, anxiety, and just the overall well-being. I personally feel that your mental health is part of your physical health, and if you improve your mental health, it could have a positive impact on your physical health. Despite medical results against the belief, researchers still conclude that being optimistic may improve quality of life. For those who ask, how can a positive attitude help cancer patients? There are many studies suggesting that a positive attitude can lead to healthier habits like eating better and exercising more frequently. Learning more about their disease and treatment options. It can cause a decrease in anxiety, depression, anger, discomfort, the sense of isolation, risk of suicide, and alcohol and drug abuse. It also helps patients adjust to the effects of cancer and its treatment. All of these things will increase the ability for them to enjoy life more. Mindfulness meditation would help these patients learn to be aware of what you feel, learn to let it go, and not allow it to distract them from their life before cancer. I have a quote here that says, "Everyone wants happiness, no one wants pain, but you can't have a rainbow without a little rain." When reading this quote, I thought about how there is so much pain and problems in the world, but there is also so much beauty and things to be grateful for in this world and in our lives that we tend to overlook and not be mindful of. Now that we have some background knowledge, I would like to introduce you to some articles I found backing up my proposal. The purpose of my first article was to measure the impact of mindfulness-based stress reduction, MBSR, on health among patients with cancer. This study talks about how mindfulness meditation can be helpful to patients with cancer from diagnosis through treatment, follow-up care, and survival, as well as at the end of life. Cancer diagnosis, treatment, and survivorship are all associated with a multitude of psychological and physical consequences. In this study, all participants were patients with breast and prostate cancer. All intervention studies used the MBSR program, but the duration of programs varied from 6 to 8 weeks. The duration of practice sessions varied from 63 to 72 hours per week. After the MBSR intervention, findings showed significant decreases in negative mood, stress, and anxiety, and significant improvements in sleep quality. Results also showed significant and beneficial changes for mental health adjustment to cancer following completion of the MBSR intervention. The second article's purpose was to assess the efficacy of mindfulness-based meditation therapy on anxiety, depression, and spiritual well-being of Japanese patients undergoing treatment. A secondary goal was to assess the relationships among anxiety, depression, spiritual well-being, growth, appreciation, pain, and symptoms. The subjects participated in 2 sessions of mindfulness-based meditation therapy, including breathing and yoga movement. Each patient was trained in the program in the first session, and then was to exercise at home with a CD. And afterwards, they met with an interviewer in the second session after 2 weeks. Interviews were directed individually by nurses or psychologists with training in the program. Patients completed both pre-intervention and post-intervention questionnaires on anxiety and depression, spiritual well-being, appreciation, growth, pain, and symptoms. The anxiety and depression scale significantly decreased after the intervention. The spiritual well-being scale increased. There were also significant associations between spiritual well-being and anxiety and depression, spiritual well-being and growth, spiritual well-being and pain, and appreciation and growth. All of these were positively correlated except for spiritual well-being and growth. My third article examined the effects of an 8-week mindfulness-based stress reduction program on the sleep quality of a heterogeneous sample of 63 cancer patients. Participants were to complete a questionnaire at the start and completion of the program. Participants were to attend 5 of the 8 sessions. The findings showed that overall sleep disturbance was significantly reduced, and participants reported that their sleep quality had improved. There were also a significant reduction in stress, mood disturbance, and fatigue compared to the control group. These benefits persisted after a 6-month follow-up. My fourth article is a study that examines the prevalence of mind-body complementary therapy use, also known as MBCT, and the health-related quality of life in a group of Malaysian cancer patients. A cross-sectional study was conducted on 184 cancer patients. MBCTs were assessed using a self-administered questionnaire, while the health-related quality of life of the participants was assessed by using the Treatment of Cancer Quality of Life questionnaire. Health-related quality of life scores showed a significant difference in all functional and symptoms scores among the MBCT users and non-users. Most of the therapy users showed significant poorer scores in the symptom scale such as insomnia and fatigue, but meditation was recommended as one of the interventions to help patients cope with such symptoms. Meditation was the 3rd most commonly used therapy among the study participants. The results for meditation claimed significant reductions in depressive relapse as well as psychological distress. Part of meditation is to be accepting and aware, and it is difficult for someone to accept that they may be dying and do not know if they will recover. But meditation can help to keep those negative thoughts and feelings away and create a more positive attitude. All the research suggests nothing but improvements in quality of life and a positive attitude, and nothing but decreases in symptoms associated with cancer. These patients already have so much on their plate, so if anything can be done to make it better, then it is worth a try. You always need support when you're going through a difficult time, and I think that mindfulness meditation can be that support. Here are my references of the articles that I used to support my proposal.